Heal varicose veins with a 20-minute routine. Varicose veins are a common concern that many people face, often characterized by enlarged and twisted veins that can appear blue or dark purple. While they can be unsightly, they may also cause discomfort, heaviness, and even pain in the legs. These issues are primarily the result of poor circulation, weakened vein walls, and damaged valves. Dr. Barbara O'Neill, a renowned health educator and naturopath, has shared several natural approaches to address this condition. By incorporating her 20-minute daily routine and following certain lifestyle modifications, you can support your vein health and potentially reduce the severity of varicose veins. Warm up to stimulate blood flow. The routine begins with a gentle warm-up to stimulate blood flow. This step is crucial because circulation plays a key role in alleviating the pressure on your veins. Simple activities like walking in place or light marching for a few minutes can effectively prepare your body for targeted exercises. This is followed by ankle pumps, where you flex your feet up and down while sitting comfortably. This simple movement engages the calf muscles, which act as a secondary pump for your circulatory system, helping to push blood back toward your heart. Vein strengthening exercises for improved circulation. Once your body is warmed up, transitioning into vein strengthening exercises is the next step. Exercises like calf raises are particularly beneficial because they directly target the muscles in your lower legs, which are crucial for supporting your veins. By lifting your heels off the ground and lowering them back down slowly, you encourage better blood flow and strengthen the muscles surrounding the veins. Similarly, leg lifts are excellent for improving circulation in the thighs and calves. When performed consistently, these movements can reduce the pooling of blood in the veins, which is a primary cause of varicosities. Side leg lifts are another valuable addition to the routine. These movements not only help with circulation, but also strengthen the muscles on the outer sides of your legs, providing better structural support to the veins. Pelvic tilts, on the other hand, engage your core and lower body muscles while improving overall circulation. These exercises collectively ensure that the blood flow in your lower extremities is optimized, reducing the likelihood of blood stagnation that contributes to vein problems. Relaxation and leg elevation for recovery. After completing the strengthening exercises, it's essential to allow your veins to rest and recover. Elevating your legs is a simple yet effective way to do this. By lying down and propping your legs up against a wall or using pillows, you enable gravity to assist in draining the blood from your lower extremities back toward your heart. This practice can provide immediate relief from the heaviness or discomfort often associated with varicose veins. Taking deep, relaxing breaths during this time further enhances circulation and helps reduce stress, which can indirectly impact vein health. Hydration and diet for vein health. In addition to the 20-minute routine, adopting certain lifestyle changes can amplify the benefits. Hydration is fundamental for maintaining healthy blood flow. When your body is well hydrated, your blood remains less viscous, making it easier for your veins to function efficiently. Drinking enough water throughout the day can significantly reduce the risk of blood clots and improve overall vascular health. Diet also plays a pivotal role in managing varicose veins. Incorporating foods rich in antioxidants such as berries, oranges, and leafy greens can help combat inflammation and strengthen the walls of your veins. Garlic is another powerful anti-inflammatory food that promotes healthy blood circulation. Omega-3 fatty acids found in fish like salmon and mackerel can further enhance vascular health by reducing inflammation and improving blood flow. Avoiding processed foods, excessive sugar, and trans fats is equally important, as these can contribute to inflammation and worsen vein problems. Compression stockings for added support. Wearing compression stockings can offer additional support to your veins. These specially designed stockings apply gentle pressure to your legs, helping to maintain proper blood flow and reduce swelling. They are particularly useful for individuals who spend long hours standing or sitting. While they won't cure varicose veins, they can alleviate symptoms and prevent the condition from worsening. Avoiding prolonged sitting or standing. It's also important to avoid prolonged periods of sitting or standing, as these positions can exacerbate varicose veins. If your lifestyle or job requires you to stay in one position for extended periods, make it a habit to move around or stretch every 30 minutes. Simple actions like standing up, walking a few steps, or doing ankle rotations can make a significant difference in maintaining healthy blood flow. Similarly, elevating your feet during breaks can further reduce the strain on your veins. Managing stress to reduce strain on veins. Stress management is another often overlooked aspect of vein health. Chronic stress can lead to increased blood pressure, which puts additional strain on your veins. Practices such as deep breathing, meditation, and yoga can help manage stress levels while improving circulation. Regular physical activity, such as brisk walking, swimming, or cycling, is also highly effective in promoting vein health. These activities encourage the rhythmic contraction of your leg muscles, which helps pump blood back to your heart. Maintaining a healthy weight to ease pressure. Weight management is another critical factor in addressing varicose veins. Excess body weight can put undue pressure on your legs, worsening vein issues. By maintaining a healthy weight through a balanced diet and regular exercise, you can significantly reduce the strain strain on your veins and improve overall vascular health. Herbal remedies and natural treatments. For those seeking additional natural remedies, Dr. O'Neill often highlights the benefits of herbal treatments. Horse chestnut extract, for example, has been shown to strengthen vein walls and reduce swelling. Similarly, butcher's broom and grapeseed extract are known for their anti-inflammatory and vein-supportive properties. These herbal remedies can be used alongside lifestyle changes and the daily routine for enhanced results. However, it's important to consult with a healthcare professional before starting any new supplements, especially if you're on medication or have pre-existing health conditions. Hydrotherapy for stimulating circulation. Another natural remedy Dr. O'Neill advocates is hydrotherapy. Alternating between hot and cold water on your legs can stimulate circulation and reduce swelling. Simply use a shower head or soak your legs in warm water for a few minutes, followed by a quick splash of cold water. Repeat this cycle a few times to promote healthy blood flow and alleviate discomfort. Essential oils and massage for relief. If you're looking for topical solutions, essential oils like peppermint, lavender, and cypress can provide relief. Dilute these oils with a carrier oil like coconut or almond oil and gently massage them onto the affected areas. The combination of massage and essential oils can help improve circulation, reduce inflammation, and provide a soothing effect. Consistency and when to seek medical advice. Consistency is key when it comes to seeing results. Incorporating the 20-minute routine into your daily life, along with these supportive lifestyle changes, can make a noticeable difference over time. It's also important to remember that while these methods can improve symptoms and support vein health, severe cases of varicose veins may require medical intervention. Procedures such as sclerotherapy or laser treatments are available for those who do not respond to natural remedies. Consulting with a healthcare professional is always recommended to determine the best course of action for your specific condition. In conclusion, varicose veins can be effectively managed with a combination of targeted exercises, lifestyle changes, and natural remedies. Dr. Barbara O'Neill's 20-minute routine provides a simple yet powerful approach to improving circulation, strengthening veins, and alleviating discomfort. By staying consistent, adopting a vein-friendly diet, and incorporating stress management and other supportive practices, you can take control of your vein health and enhance your overall well-being. Remember, small steps taken consistently can lead to significant improvements over time. Stay inspired, take care of your body, and prioritize your health every day. Don't forget to share this valuable information with others and encourage them to embark on their journey to better vein health. If you found this information helpful, don't forget to like, share, and subscribe to support more content like this. Together, let's inspire healthier lives.